Madam Clerk.
Special presentation by Health Director Adrian Byrne on the coronavirus.
Good morning, Mr. Mayor and City Council member, Tim Snow, Fire Chief. In this time of heightened concern in regards to coronavirus, we have a special guest with us today, Adrian Byrne, who is the Health Director for Sedgwick County, and she's going to provide today some additional information, an overview basically of the coronavirus, provide some preventative measures that we can all apply to whenever we are in contact with someone that is sick. And also, the last thing that she's going to provide for us is some contact information and some resources so that we can stay up to date on the latest. So with that, I give you Director Byrne.
Good morning, Mr. Mayor and council members. I appreciate the opportunity to be here this morning to share with you some facts and what we do know and what we don't know about the coronavirus. So a little bit of information about coronaviruses in general. Coronaviruses have been around for just about as long as I have. I might be a little bit older than coronaviruses. But there are 7 types of human coronaviruses, and the common cold is one of many of those coronaviruses. So there's not just one coronavirus that causes the common cold, there are many. And the novel coronavirus that originated in China in December of 2019 is called a novel or new coronavirus because it is one that we have not seen before. And since November or December of 2019, as you've seen in the media, it's all over the media, all channels and social media, that it has spread to many other countries, and the United States is one of those countries. So I wanted to spend a little bit of time comparing and the novel coronavirus is being called COVID-19. I wanted to spend a little bit of time comparing COVID-19 to 2 other novel viruses, or at least at the time were novel viruses. And the first is SARS, which is sudden acute or severe acute respiratory syndrome. And that was out of Asia in 2003. And even though it affected less people in the globe, which was just over 8,000. It had a 10% mortality rate. So it affected many people, and more people died of SARS than flu or COVID-19 so far. And H1N1 was a novel flu virus in 2009. And Health and Medical Partners began tracking that in 2008. And then the Health Department set up a point of dispensement, or a large clinic where we vaccinated a lot of people. And Councilmember Tuttle was intimately involved with that. She was at the Health Department at that time and was a key person involved in that. And then we have COVID-19. Now, at the time, there was no vaccine available for H1N1, but several months to a year after it was first discovered in Mexico, they were able to create a vaccine. Now, COVID-19 and SARS, there was no vaccine that was available. If you look at the case numbers, again, you'll see with SARS, even though it was less than COVID-19 and H1N1, the death rate was very high at 10%. The H1N1 now is circulating in our community every year. It's part of the vaccine that is created that hopefully all of us have gotten. And during that time, over 60 million people were estimated to have been exposed, and we had cases. Now, it's estimated because the flu is not a reportable illness unless there is a death of a child involved. So you'll see the global death rate there's quite a span there, because unless it was a child, again, we don't know. But high death rate as far as the numbers. The numbers were high, but the rate was not. You can see how small that is. And then with COVID-19, again, no vaccine. There's one in the works, but it could be 12 to 18 months before we see that. So far there's about 3,000 deaths. And we're approaching 90,000 people that we know of that have COVID-19 in our world. So there is an estimate of a 2% death. And it's important not to look so much just at the numbers, but the actual percent or death rate in those numbers. We know that it's no longer just being spread by being around someone that has been diagnosed with COVID-19 or that has traveled to an infected area. It is now considered community spread, and this information is overwhelming and anxiety-producing for our community and other communities. But the best prevention is the prevention that we use every day, and particularly during flu season, and we need to use that all the time. And I'll mention this a couple times, but washing our hands and not being too quick to wash our hands, taking some time to wash our hands, washing under our fingernails, between our fingers, sing the ABCs or happy birthday a couple times, and making sure that we keep our fingers away from our face. And we're human, and I'm bad at that, putting my finger in my eye or something. And so that is one way that we spread it, because you can come in contact with it, but unless we're putting our hand to our face and giving it that avenue into our body, then the prevention is going to work as far as minimizing that spread. And staying away from sick people as much as you can. Sometimes they're asymptomatic, whether it's the flu or coronavirus 19. We're finding that there can be people that are asymptomatic, just like with a common cold, that are still spreading COVID-19. So when you hear community spread, that can be frightening to people, but we have viruses that are spreading in our community all the time. Community spread just means that we don't necessarily know where we got the virus from. We just know that we're sick. And so community spread is something that happens with a lot of viruses, and now with COVID-19. Back to the comparison with SARS, we haven't seen any cases since 2004. H1N1 again is endemic as far as it occurs every flu season. It is part of what is circulating right now. And with COVID-19, it's kind of a moving target. There's new information coming in all the time, and really the situation changes daily. Between Friday morning and Sunday night, there was a lot of information that came in, and particularly that it was definitely spreading in our community. Now, what I really would like to focus on this particular slide is that our community has dealt with outbreaks and even pandemics before, because H1N1 was considered a pandemic because it spread throughout the world and affected a lot of people quickly, and we had deaths. So our community is not new to having to stand up and deal with illnesses. Local responses. The health department and other local health departments in Kansas and around the country are in regular contact with their state health department and CDC. When there's a situation like this that occurs, then that contact ramps up. We are in contact with our state health department, Kansas Department of Health and Environment, during the day, sometimes several times a day, and are on phone calls with the Center for Disease Control and Prevention as far as webinars. Our health department, and particularly those that are medium and large and have epidemiologists, part of what we do every day is that we are always watching what is occurring in the world and in our country, in our state, and locally, to be aware of any possible health threats that might be occurring in our community or coming to our community so that we can respond. And so that part is not new. We have trained staff that are trained just to respond to disease outbreaks, calling contacts of people that we know have particular illnesses. We have experience, as I mentioned earlier, with responding to H1N1, and we have had 2 outbreaks with measles, 2014 and 2017. 2014 had a lot of hundreds of contact investigations that were performed. So when it comes to COVID-19, there is still a low risk for our community of contracting COVID-19. It is not in Kansas yet. It's not in Sedgwick County, and I say yet because it is coming. It is, since it's community spread, we know that it is coming. But we are of low risk. We did have 2 people that were under investigation, and if you hear PUI, that's person under investigation. So we did have 2 in Kansas, but they tested negative for the virus. So symptoms, they are mild to severe. Most of the population are going to have very mild symptoms like a cold, or may not even know that they are carriers because they're not sick. And we've seen that occur around the country and around the world. So it can be very severe where there's shortness of breath. What we know about COVID-19 is that it really is most detrimental to our older population over 65 and those that have pre-existing conditions such as diabetes, heart disease, cancer, lung disease, and that population is usually most at risk when we're talking flu or a lot of illnesses that we have. Some are developing pneumonia. So it is difficult if someone believes that they are ill. We have CDC and the state health departments have very specific guidelines if someone has symptoms, depending upon where they've traveled, if they've traveled from an affected area and don't have symptoms. So there are very laid out steps that local health departments are taking at this point. And as far as prevention, don't share drinking cups or utensils. Sometimes people share their cups or share their water bottle, and it's important not to do that. And again, stay home if ill. You've heard that people are, if they have come in contact with someone that has tested positive for COVID-19, then they are staying in their home for 14 days to minimize the potential spread of COVID-19. Again, that is not, we don't have COVID-19 in Kansas or in Sedgwick County at this point. It is coming. We don't know when, but it is coming. So there are a lot of myths out in the community about COVID-19. And again, I'll say there's a lot that we don't know. We're learning more every day about this novel coronavirus. But one of the myths is that everyone is at high risk for this. Everyone is not at high risk for coronavirus. It's like the flu. I mean, we are all at risk for the flu. There's particular populations that are more at risk for the flu because of other illnesses that can occur when they get the flu because of their immune systems already being compromised. But everyone is not at high risk for coronavirus. Another is that COVID-19 only affects older people. And again, that's not true because anybody can get COVID-19. It's just that the majority of the population, when it does come, and it is all over our country as we know, the majority have very mild to no symptoms. Another myth is that wearing a mask will prevent someone from getting COVID-19. That is not true. A lot of the masks that you see that someone might have on in the community, that reduces the chance of when someone coughs or sneezes of that being, airborne or landing on a surface. But it's no certainly no guarantee of it preventing anyone getting ill. And so there is not a best practice or a recommendation at this point for people to rush out and buy masks and be wearing them in the community, unless your physician suggests you wear a mask, or sometimes, depending upon the hospital unit, they may want someone to wear a mask just to prevent, if they are ill, there being any germs spread. Another myth is that you can get the virus by receiving packages from China. Now, at this time, it really isn't known how long COVID virus might remain on a surface, but the chances of it surviving coming from a package in China are slim to none at this point. Now, additional information and to talk a little bit more about what we're doing in Sedgwick County. All of our partners, our medical and our first responders train for outbreaks and train for epidemics and pandemics. And we all have emergency operation plans and pandemic plans that we train on. And again, some of us have actually been able to practice that in real life. We are in constant contact with our medical community and have another large meeting set up this week to meet with our medical community and our first responders to ensure that we're united in regards to being on the same page, putting out the same message to the community, being aware of what resources that our hospitals have, what our partners might need, looking at ways that we can continue with the health department to continue to support our community. Where we will be directing the community for informational calls, which we've done before, is our partner United Way 211. We've utilized them, did during H1N1 and did during measles outbreaks when the community had questions, because fear creates a lot of thoughts sometimes that are not true. And so we work with 211 to give them information, all the questions that we're aware of that have come in, and what we hear from 211 and other partners. We provide a fact sheet to 211 so that the community can call and get information from them. And then our medical community will continue to call our disease hotline so that they can reach one of our epidemiologists and receive guidance there. Right now, KDHE is being selective about who they are testing in regards to symptoms and country, and so those types of calls are being directed to our state health department. I'm currently working with our communications department to create a fact sheet, somewhat talking points for all of our elected officials, because I've gotten calls and know that you are being bombarded with just phone calls from your community, as our commissioners are, and other of our city partners. So I'll be providing that to you and updating that. And on our Sedgwick County website and our health department site, we have a fact sheet that we are updating as new information comes in. Not so much with numbers, because that could be an hourly update that we have, but pertinent information about any guidance that is changing. One thing I can tell you that will not change, and that is how you prevent the spread of illness. And it might seem too simple, but it makes all the difference in the world. And so the hand washing can't be minimized as far as how important that is. Hand sanitizer will do in a pinch, but soap and water is the best prevention from the spread of disease and illnesses. And again, keeping hands away from our faces. So in summary, even though COVID-19 is new and there's a lot that we don't know about it, and it's heightened anxiety in all of our communities, ours as well, there's a low probability of coming in contact with it and getting very ill. Again, it is coming, but the best prevention is the prevention that we use every day. And currently, I'm truly concerned more about the spread of the flu, because in our country, we've had over 18,000 deaths related to the flu. And we're used to the flu in our community, so we can forget how deadly the flu can be. And we have deaths in Kansas every year. That the flu is still very alive and well in our community. There are still flu shots available, even though it is March. It is not too late to get a flu shot, because it is still here and could be for quite a while. It oftentimes starts slowing down greatly. March, April, it's still going. So if you haven't gotten that flu shot, please get your flu shot. I'd be happy to answer any questions.
Questions for the conferee? Chair recognizes Councilmember Tuttle.
Thank you. Adrian, thank you for being here today and for the updates. And I would request that you would go back to the Sedgwick County Division of Health, my friends there where I worked for 5 years, and thank them for their work on this. I remember during H1N1, the happiest email that I have ever sent during my entire life was on week 26 when we demobilized and were able to stop operations of vaccination and education in the community. During that 26 weeks, not only did we work on H1N1, we still did our other jobs. Yes. And so I know your staff right now is working extremely hard to protect our community and make sure everyone is safe. So thank you for all that you're doing. We really appreciate it, and we'll look forward to getting more updates. Thanks.
Councilmember Johnson.
Thank you, Mayor. I had just 3 questions. One, did I hear you correctly to say that if somebody had this, they would probably need to stay home for 14 days?
If that is the guidance at this point, but we would be involved with that as well as their medical providers. We would be monitoring them while they were at home. There's a strict protocol that we would follow, as well as other health departments and hospitals. But yes, that they would stay at home for 14 days.
Okay. Second question, I know that this is kind of focused on our older citizens. Is there still a risk to younger kids like 5 and under?
We are not seeing that around the country. It is really targeting the older population. And during H1N1, one of the reasons that novel flu virus was really scary is that healthy people were dying. And we vaccinated people by risk. And we didn't start with the older population. We started with children and pregnant women and healthcare workers. And that was really different for our older population because they're used to being, first in line. So the older population are more at risk. We are not seeing that with young children. We are suspecting that they are carriers around the country, but they are asymptomatic or very, very, very mild symptoms.
Appreciate that. My last question. I know that soap and water is always one of the best things to do. Would you also say that like normal remedies of vitamins or elderberry or like emergency that drink is still good to take, or would that not help at all?
So were you asking if someone should be prepared at home as far as
like
water?
just taking elderberry every day?
Oh, well,
vitamins.
Can't say that's a best practice, but I know a lot of people think that's a good thing. So being healthy, doing what anyone can to stay healthy is always good as far as getting adequate sleep and fruits and veggies. And sometimes when we're in a hurry and stressed, it's easy to go to the quick and bypass all those healthy things. But it is really important to also have a strong immune system when it comes to helping fight any virus.
Okay. Thank you so much.
Councilmember Tuttle.
I just wanted to make one more shameless plug, and Councilmember Johnson brought it to my attention. One of the things that was key during H1N1 is we encouraged faith-based organizations, schools, and workplaces to make sure that you have a continuity of operation plan in case you do have this or any other virus spread through your workplace. And so I know the health department can provide technical assistance and does trainings on how to develop a continuity plan, so that way if, Tuttle Inc., for example, has 4 or 5 people out, how do we make sure that we can keep performing and make our customers happy? So reach out to the health department if you need assistance with that.
Absolutely. And I will also be doing weekly updates at the BOCC every Wednesday morning, and would be happy to present or answer any questions again, should you have any.
Further questions or comments? Seeing none, we thank you.
Thank you.
Madam Clerk.